Think you know sickle cell disease? We're going through 20 must-know questions for nursing students. But here's the challenge. Most students fail before question 10. Can you beat them? Let's find out. Question 1. Which statement best describes sickle cell anemia? A. A viral infection that destroys red blood cells. B. A hereditary disorder causing abnormal hemoglobin production. C. An autoimmune condition targeting white blood cells. D. A nutritional deficiency affecting iron absorption. The correct answer is B. A hereditary disorder causing abnormal hemoglobin production. Sickle cell anemia is a genetic disorder caused by a mutation in the HBB gene. This results in the production of abnormal hemoglobin S. It is not caused by a virus, an autoimmune response, or a nutritional deficiency. Question 2. The abnormal hemoglobin responsible for sickle cell anemia is known as A. Hemoglobin A, B. Hemoglobin C, Hemoglobin F, D. Hemoglobin S. The correct answer is D. Hemoglobin S. Hemoglobin S, also called HbS, is the abnormal hemoglobin produced in sickle cell anemia. HbA is normal adult hemoglobin, HbF is fetal hemoglobin, and HbC is a different variant that is unrelated to sickle cell anemia. Question 3. Which genotype correctly represents a patient who has sickle cell trait only? A. HbSS, B. HbAS, C. HbSC, D. HbAA. The correct answer is B. HbAS. HbAS means the patient has one normal hemoglobin A gene and one sickle S gene. This is sickle cell trait. These patients are carriers and are generally asymptomatic. HbSS is full sickle cell disease. HbSC is a variant form of the disease, and HbAA is completely normal. Question 4. A patient with HbSS genotype asks the nurse how their condition differs from someone with sickle cell trait. The nurse correctly explains that sickle cell disease A. Only affects patients during periods of extreme stress, B. Is caused by inheriting two abnormal HbS genes and is symptomatic, C. Results from one normal and one abnormal gene and is usually asymptomatic, D. Is less severe than sickle cell trait due to partial hemoglobin protection. The correct answer is B. Is caused by inheriting two abnormal HbS genes and is symptomatic. HbSS means the patient inherited two abnormal sickle genes, one from each parent. This results in full sickle cell disease with symptoms. HbAS trait involves one normal and one sickle gene and is largely asymptomatic. Sickle cell disease is not limited to periods of stress, and it is not milder than sickle cell trait. Question 5. Which of the following sickle cell disease types is considered the most clinically severe? A. HbSC disease, B. HbS beta thalassemia, C. HbSS disease, or D. HbAS trait. The correct answer is C. HbSS disease. HbSS is the most severe and most common form of sickle cell disease. These patients have no normal hemoglobin A, which leads to frequent and severe crises. HbSC and HbS beta thalassemia are milder variants, and the HbAS trait is largely asymptomatic. Quick warning, question 10 trips up almost everyone, so pay close attention and don't skip ahead. Question 6. Which organ is primarily responsible for destroying abnormal sickled red blood cells, contributing to hemolytic anemia? A. Liver, B. Kidneys, C. Bone marrow, D. Spleen. The correct answer is D. Spleen. The spleen filters and destroys abnormal red blood cells, including sickled cells. Repeated sickling episodes eventually damage the spleen itself, which leads to a condition called functional asplenia, which leaves patients highly vulnerable to encapsulated bacterial infections, such as Streptococcus pneumonia. Question 7. A nurse is explaining vaso-occlusion to a patient with sickle cell disease. Which description is most accurate? A. White blood cells accumulate and narrow the vessel walls. B. The heart pumps blood too slowly through the vessels. C. Sickled cells block small blood vessels, reducing oxygen delivery to tissues. D. Blood vessels become infected due to bacterial invasion. The correct answer is C. Sickled cells block small blood vessels, reducing oxygen delivery to tissues. Vaso-occlusion occurs when rigid, sickle-shaped red blood cells obstruct small blood vessels. This causes ischemia and pain. It is the hallmark mechanism behind painful sickle cell crises and organ damage. Question 8. What is the typical lifespan of a sickled red blood cell compared to a normal red blood cell? A. 60 to 90 days versus 120 days. B. 30 to 40 days versus 120 days. C. 5 to 10 days versus 90 days. D. 10 to 20 days versus 120 days. The correct answer is D. 10 to 20 days versus 120 days. Normal red blood cells survive approximately 120 days. Sickled red blood cells are fragile and are destroyed within just 10 to 20 days. This rapid destruction leads to chronic hemolytic anemia because the bone marrow cannot produce replacement cells fast enough. Question 9. Which prenatal diagnostic test can confirm sickle cell disease in a fetus as early as 10 to 13 weeks gestation? A. Amniocentesis. B. Chorionic villus sampling. C. Chordocentesis. D. Nuchal translucency scan. The correct answer is B. Chorionic villus sampling. Chorionic villus sampling can be performed as early as 10 to 13 weeks gestation. It provides fetal DNA for genetic testing, including sickle cell disease. Amniocentesis is performed later, between 15 and 20 weeks. Chorionic villus sampling carries a slightly higher miscarriage risk but offers earlier diagnosis. Question 10. A father has sickle cell disease and the mother carries sickle cell trait. What is the probability that their child will also have sickle cell disease? A. 25%, B. 100%, C. 75%, D. 50%. The correct answer is D. 50%. When one parent is HBSS and the other is HBAS, each pregnancy has a 50% chance of the child having sickle cell disease and a 50% chance of the child carrying the trait. There is no possibility of a completely unaffected child in this pairing, making genetic counseling critical for this couple. Nice! If you made it to question 10, you're already ahead of most students. But don't get too comfortable. Question 15 is where it gets more tricky. Many students get caught off guard. Can you make it there? Question 11. A patient with sickle cell disease presents with severe bone pain in the chest, back, and extremities. The nurse recognizes this as which type of crisis? A. Aplastic crisis. B. Splenic sequestration crisis. C. Vaso-occlusive crisis. D. Hemolytic crisis. The correct answer is C. Vaso-occlusive crisis. Vaso-occlusive crisis is the most common type of sickle cell crisis. It occurs when sickled red blood cells obstruct blood vessels, causing ischemia and severe pain in the bones, chest, back, and extremities. It is the leading cause of emergency department visits in sickle cell patients. Question 12. A 4-year-old child with sickle cell disease is brought to the emergency department with sudden onset of left-sided abdominal pain, pallor, and a rapidly enlarging spleen. The nurse should suspect A. Acute chest syndrome, B. Aplastic crisis, C. Vaso-occlusive crisis, D. Splenic sequestration crisis. The correct answer is D. Splenic sequestration crisis. Splenic sequestration crisis occurs predominantly in young children and involves large amounts of blood becoming trapped in the spleen, causing it to enlarge rapidly. It presents with sudden abdominal pain, pallor, weakness, and signs of hypovolemic shock. It is a life-threatening emergency requiring immediate blood transfusion. Question 13. A 25-year-old male patient with sickle cell disease presents with a painful erection lasting more than 4 hours that is unrelated to sexual stimulation. The nurse recognizes this complication as A. Priapism, B. Avascular necrosis, C. Acute chest syndrome, D. Vaso-occlusive crisis. The correct answer is A. Priapism. Priapism is a prolonged, painful erection caused by sickled cells obstructing blood flow out of the penis. It is a urological emergency that can lead to permanent erectile dysfunction if not treated promptly. Management includes hydration, analgesia, and, in some cases, aspiration or surgical intervention. Question 14. Which neurological complication is a patient with sickle cell disease at highest risk of developing due to cerebral vaso-occlusion? A. Peripheral neuropathy, B. Meningitis, C. Stroke, or D. Guillain-Barré syndrome? The correct answer is C. Stroke. Stroke is a serious neurological complication of sickle cell disease, occurring when sickled cells occlude cerebral blood vessels. Children with HBSS have up to a 10% lifetime risk of stroke. Transcranial Doppler ultrasound screening is recommended in children to identify those at high risk, and chronic transfusion therapy is used for prevention. Question 15. Which diagnostic test is considered the gold standard for confirming sickle cell disease? A. Complete blood count, B. Peripheral blood smear, C. Hemoglobin electrophoresis, D. Reticulocyte count. The correct answer is C. Hemoglobin electrophoresis. Hemoglobin electrophoresis is the gold standard diagnostic test for sickle cell disease. It separates hemoglobin types by electrical charge, allowing accurate identification of HBSS, HBAS, HBSC, and other variants. It is used in both newborn screening programs and definitive diagnosis in older patients. Impressive! You're at question 15. Here's the kicker. Question 20 is one of the most tested sickle cell questions in exams. Missing it can cost you easy marks. Keep going. You've got this. Question 16. Which characteristic finding is seen on a peripheral blood smear of a patient with sickle cell disease? A. Spherical round red blood cells, B. Crescent or sickle-shaped red blood cells, C. Enlarged red blood cells with pale centers, D. Fragmented red blood cells with jagged edges. The correct answer is B. Crescent or sickle-shaped red blood cells. A peripheral blood smear in sickle cell disease reveals crescent or sickle-shaped red blood cells caused by polymerization of HBS under deoxygenated conditions. This morphological change is a hallmark finding that helps differentiate sickle cell disease from other hematological conditions. Question 17. Which prenatal diagnostic test can confirm sickle cell disease in a fetus between 15 and 20 weeks gestation? A. Chorionic villus sampling, B. Nuchal translucency scan, C. Amniocentesis, D. Chordocentesis. The correct answer is C. Amniocentesis. Amniocentesis is performed between 15 and 20 weeks gestation and involves extracting amniotic fluid containing fetal cells for genetic analysis, including sickle cell disease. While chorionic villus sampling can be done earlier, at 10 to 13 weeks, amniocentesis remains a widely used prenatal diagnostic option for confirming genetic conditions later in pregnancy. Question 18. Which imaging study is recommended in children with sickle cell disease to screen for cerebrovascular complications and stroke risk? A. CT scan of the brain, B. MRI of the spine, C. Transcranial Doppler ultrasound, D. Chest X-ray. The correct answer is C. Transcranial Doppler ultrasound. Transcranial Doppler ultrasound measures blood flow velocity in cerebral arteries and identifies children at high risk for stroke due to cerebrovaso-occlusion. It is recommended annually for children with HBSS between the ages of 2 and 16. Children with abnormal results are placed on chronic transfusion therapy to reduce their stroke risk. Question 19. Which surgical intervention is currently considered the only curative treatment for sickle cell disease? A. Splenectomy. B. Bone marrow stem cell transplant. C. Liver transplant. D. Cardiac bypass surgery. The correct answer is B. Bone marrow stem cell transplantation. Allogeneic bone marrow stem cell transplantation is the only currently available curative treatment for sickle cell disease. It involves replacing the patient's defective hematopoietic stem cells with healthy donor cells that produce normal hemoglobin. It is most successful in children with a matched sibling donor, though it carries significant risks. Question 20. Which nursing diagnosis is the highest priority for a patient with sickle cell disease admitted in active vaso-occlusive crisis? A. Deficient knowledge related to disease management. B. Risk for infection related to functional asplenia. C. Acute pain related to vaso-occlusion and tissue ischemia. D. Activity intolerance related to chronic anemia. The correct answer is C. Acute pain related to vaso-occlusion and tissue ischemia. Acute pain is the highest priority nursing diagnosis during an active sickle cell crisis. Using Maslow's hierarchy of needs, pain is a physiological priority that must be addressed immediately. Unrelieved pain increases oxygen demand, worsens sickling, and leads to further complications. Pain management is the cornerstone of sickle cell crisis care. You made it all the way. Comment Sickle Cell Mastery below if you completed the full quiz. Also, tell me how many questions you got right out of 20. I want to see who's really ready for exams. If this quiz helped you review sickle cell disease, make sure you subscribe for more nursing questions and check the next quiz on your screen to keep testing your knowledge.